I think of diversity in terms of a lot of different things: family composition, ethnicity, race, sexual orientation. Really, there's many different ways that we can be similar or different to people. Really, what this movement ultimately should be striving for is to have equality in how we treat people regardless of how they're like us or not like us.
First of all, it's a patient safety issue. We need cultural competency now in our hospitals. We need to have patients understand the dynamics of their patient care and what that is all about. And we also know from the literature that when we understand the culture and we communicate in ways that the patient understands, the patient is more receptive on their discharge instructions on what they need to do to take care of themselves.
It's really been a culmination of forces in our society as well as the changing demographics in the United States. In 20 years, the face of this country is going to look decidedly different. I mean, we really have been able to recognize the disparities that exist in healthcare, and I think it's all coming to a head.
With the Nursing Workforce Diversity Initiative that we've been working on for a number of years now, a number of work groups met, and there was one group that worked on curriculum and staff development. And it was that group that came up with a definition of what cultural competence is and how broad it is, and had a lot of discussion about that. And that led to the idea that we really needed to do the awareness pieces, the cultural competence pieces, before we could really work on other avenues of diversifying the nursing workforce. Our goal is to reduce health disparities, but it's foundational to be culturally competent and culturally aware.
We really need to add diversity to our workforce, and the only way to do that is to make our nursing education and practice sites more culturally sensitive. Although healthcare isn't a high priority of the foundation, education is, however. We do believe that a healthy community and a strong healthcare workforce are key to everything else we do. I really researched it and started working with the nurses. I learned so much more about how healthcare that is not culturally sensitive can interfere with health outcomes.
So the purpose of all of this, of increasing the cultural competence of the nursing workforce, is to improve the care that clients and families receive in the healthcare system, and beyond that, to reduce healthcare disparities in our country. When we talk about cultural competence, we're really talking about the ability of the healthcare provider to step into the intercultural space and understand the differences that exist between themselves and the client that they're taking care of. One way for students to get into the intercultural space is to have a clinical experience. Another way for them to get into the intercultural space is through case studies that we might do in the classroom, and also into simulation.
The OCN definition of diversity has been really critical for us, because obviously we're looking at more than skin color and language. We're talking about so many different levels of diversity, including gender, sexual identity, religions, the list goes on. And something that has been so exciting about this project is, as students started to hear more and more about diversity and cultural competency into the simulations, we started to have students approach us as content experts. For example, we had a student that asked whether or not we had considered integrating a transgendered patient into our simulation program. One of our faculty had already started to do that research. However, this student then became a content expert. She went on to share with us that her partner is transgendered and that she would be happy to share what it's like to be a family and in the healthcare system.
And the key is to even recognize that that diversity exists, and that not everybody sees the world and shares the values and beliefs that we bring to the table, and to open up an honest communication so that we can acknowledge that those differences do exist and be able to talk about them. Right now, our staff represents somewhere between 25 and 30 different ethnicities, and that's part of the cultural diversity of our staff. Then you also need to take into consideration the differences in culture among generations, among genders, and even among socioeconomic lines, educational lines, and what part of the country you were raised in, or even what part of the city you were raised in. All of those are going to be part of the culture you bring to the workforce. A perfect world would be one that everybody could communicate, feel respected, feel valued, and where there was true collaboration and no feeling of hierarchy.
In a perfect world, we would have a nursing workforce that is culturally diverse, mirrors the population that we serve, be understanding, compassionate, smart, make good decisions, and help our citizens make good decisions, and I think we would have healthier people.
For clinicians to really change their practice, I think it's important for us to step back and take time to really look at what are some of the assumptions, what are some of the beliefs that we've been operating on, and to try to peel that back to where did that come from, where did we learn that, and then to be open to new knowledge, new information, again from research and from our colleagues. I think that's the way that we can really have practice changes that will be sustainable.
It really doesn't take that much to get to that point where people begin to understand just how big an issue this is.
The concept is not a new one. We have come to a different realization about its importance. I think the pendulum has swung way to biomedicine, and I think it's time to swing back. And I am so excited about the future of nursing because we are just right on the forefront of we have to do this. It's time.
As nurses, we must take the time to understand our client's culture. This is not just a race, religion, or ethnicity. It is a person's identity. We must not assume that every client we take care of is going to be of the same culture. Just as we look around at the people we work with, we are a very diverse group of people, and no two people have the same likes and dislikes. Health disparities are different amongst all different cultures as well. One disparity is that minority groups experience higher rates of illness, death, and poor health outcomes in general, more even than your average white, non-Hispanic population. You should also consider the quality of care in different races and people who do not speak English as their primary language. Oftentimes, the person may not be able to communicate their needs. Health caregivers who are not culturally competent may not use available resources to assist in caring for the client. For example, the nurse walks into the patient room and discovers that they speak Spanish only. The culturally aware nurse will call for an interpreter, seek out assistance from other healthcare staff that speak Spanish, and help to decipher what the patient needs are. What is interesting about cultures is that each culture, no matter where it is located, shares at least 5 basic characteristics. This means the Mayan culture, which is now extinct, shared at least 5 basic characteristics with present-day American culture. The 5 basic characteristics that all cultures share are that they are learned, shared, based on symbols, integrated, and dynamic. Learning occurs through life experiences shared with other members of the culture. Values, beliefs, and traditions are passed down from generation to generation and taught either formally or informally. Some generations totally adopt the values, beliefs, and traditions of their elders. Others partially accept the teachings, and then some generations move strongly away from them. Cultural norms are shared by all members through teachings and social interactions. Cultural customs, beliefs, and practices are not static. They change over time and at different rates. Cultural change occurs with adaptation in response to the environment. Cultural assumptions and habits are unconscious and thus may be difficult for members of the culture to explain to others or to identify as different from another culture because of how they were developed within the person. Think back to your early childhood. Were there certain values that your parents ingrained to be of high importance and things that were unacceptable? How many of them have been different from your best friend or your classmates' values? Cultural competence is the ability to provide effective care for patients who come from different cultures. It requires sensitivity and effective communication in nursing, both verbally and nonverbally. Cultural competence and respect for others becomes especially important for us in the nursing practice because we are patient advocates. The patient depends on the nurse to provide safe and effective care. If the nurse is not able to look beyond the differences between him or herself and the client, holistic care cannot be given. The development of cultural competence in the nursing practice first requires us to have an awareness of the fact that many belief systems exist. At times, the healthcare practices of others may seem strange or meaningless. We must remember that we do not need to understand these beliefs completely, but we do need to respect them. The more effort we put into learning about other cultures and belief systems, the care we provide will greatly improve. Most importantly, make an effort to gain the patient's trust for a stronger nurse-patient relationship. This may take time, but everyone will benefit if this is accomplished. If the patient knows that the nurse has their best interests in mind, the patient and nurse can work together to accomplish goals. The patient who does not believe that the nurse is concerned with their well-being may shy away or disengage, thus causing poor patient outcomes. Early in her career as a nurse, Madeline Leininger recognized the importance of the concept of care as being the center of nursing. During the 1950s, while working in a child guidance home, Leininger experienced what she describes as a cultural shock when she realized that recurrent behavioral patterns in children appeared to have a cultural basis. Leininger identified a lack of cultural care knowledge as the missing link to nursing's understanding of the many variations essential in patient care to support compliance, healing, and wellness. These insights were the beginnings of a new phenomenon related to nursing care called transcultural nursing. There are several major concepts in Leininger's theory, but we will focus on 3 of these concepts. First, there is transcultural nursing. This is a learned branch of nursing which focuses on the analysis of cultures with respect to nursing and health illness caring practices, beliefs, and values, with the goal to provide meaningful and effective care to people according to their cultural values. Professional nursing care is defined as formal and cognitively learned professional care, knowledge, and practice skills obtained through educational institutions that are used to provide assistive, supportive, enabling, or facilitative acts for another individual or group in order to improve a human health condition or well-being, disability, life way, or to work with dying patients. And then last, we have cultural care, which is defined as the subjectively and objectively learned and transmitted values and beliefs that support or enable another individual or group to maintain their well-being, improve their life, or to deal with illness, handicaps, or death. So what I'm saying here is that Madeline Leininger paved the way for the concept of nursing as a combination of science and caring that we know today. A dominant culture is a group that has the most authority or power to control values in a population. It is typically, but not always, the largest group. In the United States, Anglo-Saxons have been the dominant culture for most of history. Now think about the area that you live. What is the dominant culture there? Depending on your culture, it may be different than the white Anglo-Saxon. Maybe it is Hispanic or African American. Do you live in an area where the majority of your neighbors or the community are of the same culture? If this is the case for you, then you are part of a subculture. A subculture is a group within a larger social system that have similar characteristics which are not always the same as those of the dominant culture. As described by the American Journal of Nursing, vulnerable populations include the economically disadvantaged, racial and ethnic minorities, the uninsured, low-income families, the elderly, homeless, those with human immunodeficiency virus or HIV, and those with other chronic health conditions which include severe mental illness. It may also include rural residents who often encounter barriers to accessing healthcare services. The vulnerability of these individuals is further heightened by race, ethnicity, age, and gender, among other issues. Their long-term health outcomes are often not their major concern due to their need to just survive day to day. When providing care to the different populations, nurses must consider what resources are going to be available to the person when they leave. Do they have food, shelter, or means to follow through with the orders set by the physician? Like stated before, our duty as the patient advocate is to lead them to obtainable resources and provide teaching foster to their level of comprehension. The data you gather for a cultural assessment should never be assumed by your own beliefs. The nurse should speak directly to the patient to obtain information regarding certain aspects of how they feel that their care should be performed. If the patient is unavailable, the nurse should talk to the family. When completing the physical assessment, consider the ethnicity of the patient when evaluating the variations in skin tone. What may be abnormal pallor in one person may be another person's normal skin. You also want to consider verbal and nonverbal cues alike when assessing pain. Response to painful stimuli vary greatly in many cultures. You will have patients that will never tell you that they are having pain, and you'll have to rely on your physiological cues, and others will give you no doubt that they are having pain. One huge aspect of caring for your patient is language barriers. Your patient may not speak English, or it may be very dissected. Do not assume that the patient can comprehend what you're saying or doing. When gathering information from the patient, you will also ask if there will be any needs such as religious items. Family members might have to be present, or other necessary items to make them more comfortable. Some cultures do not allow care to be performed by someone of the opposing sex. If this can't be granted, they may request that the spouse can be present at all times. Nurses should always try to accommodate as much as possible if it is safe to do so. Even if it does not seem to be of major concern, the nurse should ask the patient about any special diet needs. Think about different cultures. What are some of the diets that you can think of? Some cultures ban the consumption of certain meats. Some require fasting intervals and even request foods to be prepared and packaged in special ways. The cultural nursing diagnoses that you choose for a patient will be based on the individual's needs and assessment. No matter how many years of nursing experience, you will never know all of the aspects of every culture. But a competent nurse will continue to grow in their abilities to deliver the best care possible. Creating an environment of understanding and respect will build a nurse-patient rapport and integrity within that nurse. So when we meet in class this week, please be sure to have your notes and questions ready regarding this concept. We will review the muddy points and complete in-class activities, and I hope you have a good night. Thank you.